Hi, good morning. Hello and welcome to everyone. Thank you for joining us. This is the web-based office hours for the Western region. This webinar is for 1 hour, so it's going to be from now until 11 a.m. My name is Laura DePaola. I'm a graduate intern at the Coalition for Behavioral Health. I'll be moderating the office hours today. Melissa Thomas is the Associate Director of Training for the Coalition for Behavioral Health, and she'll be presenting today's office hours. More about Melissa in just a few minutes, but first I'd like to share with you the format for today's webinar. This is the second of 2 office hour sessions, so the previous session was in March. And office hours are conducted regionally, so this is the Western Region's meeting. Meetings were scheduled regionally with the intention of having a smaller audience to allow for dialogue and discussion with each other, with your peers. So your role today is not just in watching the webinar. We hope to have a really meaningful discussion, and we can only do that if you get involved. So we encourage you to ask questions. We'll do our very best to answer them during our time today. So after Melissa's presentation, which is going to be about 40 minutes, we'll open it up for questions and discussion. So there are 2 ways that you can respond and participate. The first is through the chat box on the right-hand side of the panel. So you can type in your questions in that box as well. As well as I will answer, we can answer questions when we ask them. Forgive me. You type in your questions and answer questions when we ask them. All questions will be answered at the end of the webinar after Melissa is through speaking. So the other way you can participate is verbally through audio. So to do that, you use the raise your hand feature, and we can unmute your line and you can actually speak your question. All of these webinars are recorded, including today's presentation, and they're going to be available on the CMTI website. There we go. So the New York State Care Management Training Initiative is brought to you by several partner organizations: the New York State Council for Community Behavioral Health, the New York Care Coordination Program, the Center for Practice Innovations, the Coalition for Behavioral Health, the National Council, and the New York State Association of Psychiatric Rehabilitation Services. Just a couple of housekeeping items. Your attendance will be recorded, and at the end of the webinar, you will receive a certificate of completion. We encourage you to complete an evaluation at the end of the webinar. Evaluations are required to obtain continuing education hours. And social work, LMHC, CPRP, and CRCC hours are available to everyone who completes the series. So if you have any questions about CE credits, you can visit the FAQ on the website, and you could or email Ruth Cologne-Wagner from NIAPRS. Her email is ruthcw@nyaprs.org. So Melissa, just to introduce Melissa, she is a social worker and the Associate Director of Training at the Coalition for Behavioral Health, where she does training, technical assistance, consultation to on a variety of topics to our behavioral health provider membership in New York City. Her areas of training and expertise include person-centered planning, mental health first aid, implementation and integration of home and community services, etc. So before she was at the Coalition, she worked for mental health rehab programs here in New York City, and she has a lot of practice and supervisory experience, so I think you're going to learn a lot from her today. So take it away, Melissa.
Thank you, Laura, and good morning, everyone, and thank you for joining me today for the Care Management Training Initiative's online office hours. So the purpose of office hours is to recap the information presented in the webinars and the videos you've seen thus far, and to build on what you already know and to continue to learn from one another. And if you haven't had a chance to review the 2 videos and 6 webinars that have been previously or just recently posted, they are available for your review at your convenience. The most recent one was just facilitated yesterday on health literacy, and that is available on the CMTI website. And since this is just a brief review of each topic, I encourage you to please refer to those recordings for more information and a deeper understanding about the content material. But for today, we will be discussing the definition of integrated care and your role as a care manager, the elements of motivational interviewing and how it can be used with SPIRT, getting to know the culture of the person and the community that you live and or work in, understanding why outcomes are important, the care manager role in care transitions, what it means to increase our health literacy as well as the health literacy of those that you serve, and finally, the benefits of supervision and understanding the importance of self-care. So we're going to start off today talking about what is integrated care. And at the bottom of each slide, you will see the webinar or the video that I'm referencing in case you want to go back and take another look at it. So what integrated care is discussed in webinar number 6. And integrated care is the ideal situation that we would like to create for the people that we work with. And it's when physical and behavioral health care occurs between both providers, and both providers work together to address the physical and the behavioral health needs of the people that we work with. Unfortunately, this does not happen as often as it should, but it's something that we should strive for to become the standard and become the norm. And when we talk about the aim of the triple aim of improved population health, which includes reducing healthcare costs and enhancing the health outcomes of the individuals we serve, integrated care is key. Chronic illness is the #1 healthcare problem in the United States, so your role as a member of an integrated team is extremely important. Outcomes for people with mental health conditions are less hopeful than the general population, yet most of the illnesses that they suffer from are preventable, such as diabetes, heart disease, hypertension, and obesity. So it's really important that you get to know the whole person, both behavioral health and physical health care needs, and because it impacts upon the social determinants of health, which we'll talk about briefly in a moment. So integrated care is very complex and does not look the same in every setting. So there are some steps you can take to promote health integration, such as developing partnerships with primary care physicians. So that means bridging the gap in services, targeting outreach to your colleagues, or even utilizing community resources that are already available. We also want to increase our own health literacy, which can impact, again, on the social determinants of health. And that means learning more about the causes, the side effects of some common illnesses, and even preventative care. And finally, providing support to the people that we're working with. So developing strong motivational interviewing skills and using it to find out what is important to the person, and developing a plan together on how to assist them in goal achievement. We also want to acknowledge that change can be difficult, and at the same time remain hopeful that it is definitely possible. We want to use our available resources and support concrete short-term goals, because they are just as important and equally important as to someone's long-term goals. We talk about motivational interviewing, I believe, in almost all of the videos and webinars. And it's so important because it can make or break a working relationship that you have with someone, and can also limit how much that person engages with you or partners with you in their care planning. So just a brief review of motivational interviewing. It is a client-centered directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. So motivational interviewing is really about guiding and strengthening someone's internal motivation to change. We're not trying to convince them to change it, but really use what motivates them to change. We want to use someone's own motivation to change their circumstances, to help them recognize the need to change their circumstances. And motivational interviewing is not clinician-centered per se. Anyone can learn it, anyone can practice it. And I want to show you an example of the opposite of what motivational interviewing is, and sometimes what we may do unintentionally, but can occur quite frequently. The doctor says, stop overeating, stop drinking, stop staying out late, stop fighting, stop worrying, stop eating sweets, stop gambling. And then later his wife asked him, what did the doctor say? I don't know, I stopped listening. And so sometimes this scenario is not that much different than those that we work with, and when we are unintentionally, again, trying to perhaps impose what we think is best for the person. And in this case, the character may very well need to do all of the things to improve his health, but by telling him and expecting change versus finding out what his particular motivation is to better his health would have yielded a better outcome. To find out what his motivation is or could be, the doctor could have used what is referred to as ORs. So I'm sure you've all are familiar with this and have heard this before, but it's asking open-ended questions, trying to understand the person's experiences and trying to avoid yes or no questions. Because yes or no questions do not necessarily give us the why of someone's motivation and doesn't really reflect a partnership. And it's also okay to ask for clarification if we don't understand or want to get a deeper understanding of what someone means. So for example, asking someone, how will your life change if this were to happen? If we were to remove the word how, it would then become a yes or no question. It would just read, will your life change if this were to happen? And the person would respond with a yes or a no, and yet it would give us no better understanding of what their motivation is, what they're thinking, and what they're feeling. So we really want to try to avoid those type of questions and make sure that it's open-ended. We also want to provide affirmations, which provide support, which are genuine and demonstrate our understanding of what the person is experiencing. Providing affirmations really reinforces positive behavior change, and we want to use affirming words that people can identify with. Some of those words can include telling someone that they're being really persistent in their goal achievement, they're strong, they're reliable, and that they're really focused. So those are really words that demonstrate that behavior change and that we are recognizing that change is occurring. We also want to practice reflective listening, which actually should be used the most out of all 4 of these. And it shows that we're listening by providing brief comments reflecting back to the person what we're observing or what we're hearing. Reflective listening is not problem solving or giving advice. So a good practice is to ask during a conversation to ask 50% questions and then 50% reflections, or asking one open question and then having 2 reflections to follow after that. And then finally summarizing or pulling together several things that the person has told you. So we're reviewing the content of the conversation in order to gain clarity and making sure that both the provider and the participant are on the same page. So you can start off that summary by saying, so this is what you've told me so far. And if for some reason we've misinterpreted or misunderstood what someone said, this is the opportunity for that person to clarify what they really meant. So reflective listening and summarizing both provide the openness or provide the opportunity for the person, again, for both of you to be on the same page and have a mutual understanding. And with all of this, we want to consider culture, values, history of trauma, and recognizing a person's strengths and really remembering the spirit of motivational interviewing, which includes partnership in planning and decision making with the person. It's really important to engagement and how much or how often someone engages with you, and you really want to think about how we approach or work with someone and make sure that it is a partnership. The spirit of motivational interviewing also includes evocation, so asking about ideas, opinions, and concerns. Asking someone, for example, what has worked for you, or what hasn't worked for you in the past, in order to not repeat the same thing. And even asking someone, what do you think about this? What do you think about taking these steps? What do you think about this goal? Is all an example of that. We also want to display compassion. Each of us, including those we work with, is an expert in our own life. We want to account for and recognize someone's personal values as well as their strengths. And with that, we want to accept someone's decisions. We want to honor their autonomy. It may not exactly be what we recommend or what we would do for ourselves. However, we want to respect that as people are more willing to engage if their choices are being honored and respected. So using motivational interviewing with people who are at risk for substance use. It is not used to diagnose a substance use disorder, but it's really a way of looking for unhealthy substance use patterns or providing early intervention. An example is discussing the side effects of use, whether that's drug or alcohol use with prescribed medication, or noticing that someone has actually increased their use and really looking into the causes for that. So we would want to start off with screening and using a validated screening tool that can be used to assess for risk and what some of those risk factors may include. In webinar number 7, there are examples given of different types of validated screening tools, one including called AUDIT, which stands for the Alcohol Use Disorder Identification Test, or DAST, which stands for the Drug Abuse Screening Test. And once we have provided screening to an individual, we want to then go on to a brief intervention. And this is really where motivational interviewing can come in, and the use of ORs. And so the different types of brief intervention, or one type, I should say, of a brief intervention includes what's called FLOW, F-L-O, or it's feedback, listen and understand, and options explored. And again, this is further discussed in webinar number 7. And then finally, once we have screened the individual and provided brief intervention, we want to refer that person to treatment if necessary. So coordinating their care, and it should really be based on person-centered client wants and needs, finding out what options fit their needs and their comfort level, and most importantly, finding treatment that fits into their preferred culture. So we talk about engagement, motivational interviewing, and person-centered care and planning, which are all very relevant to working with someone. But again, culture is really what we have to take into consideration, because it means different things to different people. And motivational interviewing is useless unless we have really developed a relationship with the person and developing that positive working relationship. Remembering that culture is not just about religion, ethnicity, or race. It is a way of life for a group of people or individuals that encompasses attitudes, behaviors, beliefs, values, and even symbols. And they are pieces that are accepted and passed along by communication and imitation from one generation to the next. So some other cultural considerations besides, again, religion, ethnicity, and race could include the roles that people have in their life, within their family, within their community, and what it means to them. What are some important customs that are important to the individual that can impact their view on healthcare? What are their values, their thoughts, or their manner of interacting with other people, and even language spoken, their preferred language, their first language, who they prefer to communicate with. Someone may prefer to communicate with a man versus a woman for whatever reason. It could be culture, it could be because of history of trauma. So we really need to take a look at all of this in order to make sure that we are taking into account what someone is comfortable with and what is best for them. And when we talk about cultural competence and person-centered care, we also need to remember that culture is both experiential and inherent. So experiential meaning some people, such as yourself, your care managers, your profession is a culture in and of itself. That is a culture of all of you. You all have a common profession. You may have common experiences as a care manager. Another example could be a group of people who grew up in the same type of neighborhood. As far as inherent culture, that could be country of origin, primary language spoken, religion, or belonging to the same ethnic group. And everyone has a different cultural identity, which is shaped by experiences, achievements, and it's a feeling of identifying or feeling of belonging to a particular group, and it's self-conception and self-perception. So besides care managers, think about different types of groups or affiliations that you yourself identify with, and that is what makes up your particular culture. Cultural competency also means recognizing the recipient as a person and noticing or identifying any biases when they exist. So biases can be caused by a difference in culture and values and may unknowingly impede service delivery. So different types of biases can include having a stereotype about a particular group of people, prejudice, discrimination, or stigma. And oftentimes this is influenced by other people, the media, and news outlets. So it's really important to not recognize our own biases and how it can impact engagement and service delivery. And incorporating the person-centered approach within all of this, because it focuses on the person, including their needs, their wants, desires, and their goals as they themselves define them. And we cannot have person-centered care without incorporating cultural preferences. And as far as culture and engagement, when it considers some cultural attributes such as, and we spoke about this just a little while ago, identity, how someone identifies themselves, their language and their literacy level, their origin, and how the social determinants, including income, education, housing, or even employment, has impacted upon this person's life. How do they access healthcare? Do they even believe in the healthcare system? What is culturally appropriate for them regarding healthcare? So within that, we want to make sure that we're listening to gain a better understanding of the person and their situation, who and what is important to them, being open to their choices as other people or strategies may be helpful in their process, in their recovery, and finally respecting their individual choices or methods to goal achievement or to recovery. So we can understand someone's cultural attributes by doing all of these things, and it takes relationship building and collaboration. When it comes to culture, we not only want to understand the individual, we want to get to know the community that we serve or that we even live in. So we want to understand what is the community's overall worldviews, their values, their attitudes, their cultural strengths, their barriers, and what supports are available in the community. And so we can research and ask questions such as, what is this community's history? What are some traditions and norms that exist in the community that I need to be aware about? What are the community demographics and trends? And what are the community's specific interests, needs, and assets? So all of these questions will help answer some of the questions about what are the services available in the community? How do people view these services? It could even include access to transportation or lack of access to transportation. What are some issues regarding economics and possibly poverty? So again, all of these questions are important to getting to know the individual, the community that they live in, that you live and work in. So far we've discussed working together as an integrated team, motivational interviewing, and culture, and how important each of these features are. And these are all important and contribute to that all familiar word that we hear very often in our work, which is outcomes. And we hear about it a lot, but also may feel that it has nothing to do with us or that we don't have any control over outcomes. However, outcomes demonstrate value to various stakeholders, even yourself as a care manager. And if the right information is being asked and collected, outcomes give us so much information such as demonstrating the value of the services that you're providing. It shows us through even the plan of care, one's their goal achievement, how the small-term goals are being achieved and their long-term goals are being achieved. It can help to identify any barriers in service delivery. That includes systemic barriers as well. It demonstrates staff performance, program performance, and overall agency performance as well. So we often think of, or may think of, outcomes as benefiting others, but it's really a benefit to ourselves as well, and it's a benefit to the people that we serve. Outcomes also address the triple aim, again, which is improve health with better care at a lower cost, as well as the social determinants of health. So outcomes are for everyone. And positive, healthful outcomes can be achieved by or through engagement and utilizing motivational interviewing skills. Outcomes help us to increase our cultural competency and understanding of the individual and the community. It helps to promote integrated care. It helps us to remain person-centered throughout the entire working relationship. And the plan of care in and of itself is a roadmap. It shows the outcomes that we are trying to achieve with the people that we're working with. And by utilizing systems that are already in place, helps us also to have better outcomes. So one way of addressing barriers to care and developing outcome measures can include the need to explore what's called care transitions and developing a care pathway. So this topic, again, is discussed in webinar number 12. And so when developing outcome measures, for instance, you or your agency may want to consider developing care transitions or what's called a care pathway. And a care transition is the movement of people between health locations, providers, or different levels of care within the same location as their condition or their care needs change. Care transition can occur within a setting. So an example is a healthcare practice where you have primary care as well as specialty care. So one practitioner or doctor may refer that person to someone else within their healthcare group, so it's occurring within the same setting. It can also happen between settings. So an example of that would be a hospital, someone going from a hospital to a senior center or some other type of community resource. It can also happen across health states. An example of that is someone moving or having to move from their personal home to hospice or some other type of long-term care facility. And finally, care transitions can also occur between providers. So a primary care physician referring someone to a mental health care facility or vice versa. Again, it's sort of like integrated care, but between two different providers in two different settings. So when we're talking about care transitions, we want to consider creating a care pathway. And it's a way of standardizing how we provide care by developing standard protocols for such things as administrative or clinical tasks. An example of that could be creating a care pathway for billing or documentation, creating a care pathway for how we gather information, how therapy is provided, or even how support is provided. So that way everyone is doing it in the same way, and it's a way of assessing at some point if this care pathway is beneficial to both the people being served and the staff members, because everyone, again, is on the same page and knows who's doing what. And when we're developing a care pathway, we want to try and make sure that the steps are replicable and teachable to other people. And it helps to, can even help to hypothesize why certain people are not hitting their targets, why they're not achieving their goals. So an example would be people, if developing a care pathway for those people who have been diagnosed with depression, and looking at why they're getting better or why they're not getting better, because certain protocols have been standardized. So we can start to do this, or start to develop care pathway, or some helpful benefits of developing a care pathway can include engagement, because we want to activate people toward healthy behavior change using trauma-informed care, motivational interviewing, and even family involvement within all of that, because that helps to increase one's health literacy as well as skill creation and competence. We can develop a care pathway for screening, because there will be clearly defined and standardized target parameters around how people are being screened, and making sure that it's being done in the same manner. We want to make sure it's team-based care, so standardizing, for example, who does what in a workflow, making sure that jobs overlap so that anyone could cover for someone else, but it's done in a certain way, and that everyone is doing it in a certain way, so that if one team member is absent, another team member could step in because they're following a certain protocol, a certain standard, and everyone knows what the other person is doing. And finally, if we're developing a care pathway, we want to make sure that we are conducting ongoing quality improvement to really assess for the effectiveness and the efficiency of that particular pathway. And so we're developing care pathways not just among staff members or team members. We want to include outside and referral community providers if possible. We definitely want to include the clients or the participants that we serve and their natural supports as well, and make sure that everyone is involved in developing this care pathway. So let's go on to talk about health literacy, which webinar number 13, which was actually just facilitated yesterday. And health literacy is the degree to which people have the capacity to obtain, process, and understand basic health information and the services needed to make appropriate decisions. So this is not just for the people we serve, but for ourselves as well. We also want to increase our own health literacy, because it can impact all areas of our life, which can include even how someone takes medication if they're taking it correctly. Health literacy also impacts upon health outcomes and the likelihood of whether or not someone utilizes preventative care. Health literacy also means that, or can impact whether or not someone takes their medication as prescribed. Does this person understand the labels that are on their medication? Do they understand the instructions? Are they able to manage their own health in a positive way? It could lead to poor health outcomes, which include or can include hospitalization, and again, the likelihood of preventative care, such as routine health screenings or even getting a flu shot if someone is at risk. So these are some barriers to that hinder our health literacy and the health literacy of those we serve. So whether or not someone is able to navigate the healthcare system, is a person able to locate their provider or a provider in the community? Are they able to fill out forms, medical forms, once they go to their doctor's appointment? Are they able to communicate effectively with their healthcare provider? Is it possible that there is a language barrier? Do they feel uncomfortable sharing personal information? Is there a cultural consideration that is preventing someone from effectively communicating with a healthcare provider? Another barrier is whether or not someone's able to manage their illness. Are they able to interpret the information provided by their doctor? Are they computer literate? Are they able to search for information and or apply the information that they found? Are they able to interpret or read pamphlets about diet and nutrition? So that's also an example of whether or not someone's able to manage and understand their illness. And finally, numeracy, which is understanding the probability and risk for certain health conditions. An example is whether or not someone is able to identify which method of treatment would be best for them. Are they able to compare medications and talk to their doctor about the best scenario for themselves? Are they able to compare health plan information when they're choosing a health plan and even measuring liquid medication? Or is someone able to do that effectively? So all of this includes people being visually literate, meaning they're able to read and interpret information. Are they computer literate and even information literate? Are they able to obtain and actually apply information that impacts upon their health care? And within the webinar, Laura Lagner, who was the presenter, talked about or presented a database actually with different types of health literacy measures. And within the health literacy toolshed, you can find that there are different domains and how they're measured. You can narrow it down to what you're looking for. So if you want to narrow it down based on communication, listening and speaking, comprehension, conceptual knowledge, and numeracy, you're able to do that as well. And you're able to look for specific health issues and narrow that down as well. So if you have participants who are experiencing arthritis or even heart disease, high blood pressure, or they need information about dental health and nutrition, you're able to go in and find different types of literacy measures so that you're able to give your participants in order to measure their exact health literacy. You can also, it's also available in different languages, age ranges, if you have a sample population age range that you would like to look into, and even how long it could take you to administer that particular measure as well. That's all narrowed down there, and also provides information on health literacy planning as well. So I invite you to please check out that the hyperlink that's there, and it will give you all of that information. So in video number 9, talking about supervision, we've talked a lot about a lot of different topics which are different yet all related. And so one additional topic we're going to talk about is supervision and the benefit of supervision. We, especially in your jobs as care managers, you talk to your colleagues and supervisors probably on a daily basis, but having structured supervision gives us the opportunity to address other types of things, such as change within ourselves, within the organization, within those that we serve. It's a formal setting to ask for and receive assistance. And I want to note that supervision is not just for the benefit of the supervisee, but also for the supervisor as well. It benefits both parties. Both parties can ask for and provide information and assistance. Both parties can learn from one another, teach one another. It's also a way of negotiating and problem solving. With all of the different topics we discussed, it's also a way of making sure that what we've learned is actually having an impact on those we serve. So discussing motivational interviewing techniques, discussing goal setting, and there are different types of learning styles for everyone. Not everyone is or likes the one-on-one approach. So supervision is also a way of advocating for different types of supervision. Some people may prefer to do a case presentation or prefer group supervision, so there are more people in the room and can learn and hear different opinions and learn from one another. Or even field mentoring, where a supervisor may go out into the field with their supervisee and provide constructive feedback about what they're observing with that person's interaction with our participant. So let it be known which supervisory technique works for you. And also it addresses as a way of formally addressing in the care manager core competencies. And our final topic of discussion is the importance of self-care, which is talked about in video number 9. So with all of the hard work and high caseloads that many of you have, it can lead to burnout, definitely, which includes emotional or can include emotional exhaustion. So feeling like it's a burden to go to work each and every day. Not just on Mondays, it's feeling like this quite frequently. Burnout can also lead to feeling of reduced personal accomplishment. So not seeing the value in you, no longer seeing the value in your work, or having a decreased sense of personal accomplishment, or feeling having a feeling of depersonalization. So you may be a little less person-centered or not feel as empathic towards those that you work with. So, and burnout is higher among people with high caseloads, or working with people with extensive trauma histories, or even having a lot of systemic level issues that are getting in the way of doing your jobs. So one way to handle burnout and making sure that we are taking care of ourselves is to develop a self-care action plan. And a self-care action plan can help us to manage our stress a little bit better, help us to maintain or increase our energy levels and ability to problem solve. It can help us to reduce anxiety and also increase our emotional and physical well-being. So developing a self-care action plan can include developing a healthy lifestyle or making better lifestyle choices, such as eating healthier, finding a particular exercise that you enjoy, whether it's with others or on your own. You may want to make sure you take the time out to spend time with family or friends or people that you care about, or spending time by yourself. We all need a little bit of us time once in a while, and sometimes spending some alone time can be very beneficial as well. We want to make sure we are getting enough sleep, that we are taking our vacation time as needed, or even taking an actual lunch break and not sitting in front of our computers, eating our lunch, or even skipping lunch altogether. Taking a brief walk outside even can be very helpful to sort of decompressing and taking care of ourselves during the work day. So in summary, we've talked about a lot of different topics, and I want to give you guys the opportunity to ask any questions or share some of your strategies when working with others. But in summary, integrated care must be considered in all phases of planning with the people that we work with to ensure the best outcomes. We want to incorporate motivational interviewing and remembering that it's critical to effective engagement. Remembering to take into account cultural differences as it exists in all of us. Thinking of outcomes a little bit differently, and that it involves all stakeholders, and it is a benefit to everyone that is involved in care. We may also want to consider developing care pathways in order to prevent gaps in services or in administrative tasks even. Improving our health literacy as well as the health literacy of those that we serve. And finally, utilizing supervision to our benefits and engaging in self-care often. So now I would like to open the floor to all of you to ask any questions, if you have any comments about any of the content material. And while we wait for your questions or comments to come in, I have some questions to start the conversation for all of you. Laura, are there any questions so far that I missed?
No, no question.
Okay, so I will start off the Q&A portion with the last topic that we talked about, which is self-care. So if you all would like to share, for instance, how do you prevent burnout, and to share some of your favorite self-care activities.
Yeah, so you can just type in your response in the chat, or again, you can raise your hand with that little hand raise icon, and we will unmute your mic.
It could be anything that is important to you and that helps you to deal with the daily stressors of work or home, anything that you find pleasure in.
So, so Allison Nasoy said that supervision helps with burnout, and that she also uses mindfulness, meditation, and exercise. Katie Barron said that yoga has been really helpful for her.
Mm-hmm. Mm-hmm. Yeah. Yes, I find I myself practice yoga, and I find it. I know when I need to go. I know when I've stayed away too long, and I can feel like the tension in my body, and it's like, okay, it's time for some yoga and meditation, and even practicing deep breathing at your desk can be extremely helpful to our own self-care as well. And quite honest, oh, sorry.
Oh, I was just going to say, I second Allison. I've been using some mindfulness, just like 5 or 10 minutes a day. I found has really helped me be less reactive in general, but certainly when working with clients, it's helpful, and it makes me more patient and more able to help.
Definitely. And quite honestly, after participating in these office hours, I took, even although I do practice yoga, I also run, but what I haven't been doing, and I've been telling care managers, to take a lunch break, take a walk outside, and those are things that I do not do at all. And so actually this past week, or last week actually, I started to take brief walks outside. I started to actually go take my lunch and not look at my email for at least 30 minutes of my hour. And I found it to be quite helpful. To look at emails and computers and talking about work for 7 to 8 hours a day is quite exhausting. So for even those few moments of going outside and enjoying, the sunshine, has really been helpful overall in at least getting through the second half of my day. So yes, thank you for sharing your self-care activities. Yeah. Okay, so about integrated care, what are some ways you have partnered or bridged the gap with physical healthcare providers? And is there anything in particular that you would do differently now that you have learned a little bit more about integrated care? Or the things that you've already doing that these webinars have reaffirmed?
We're not getting any responses yet. But
okay, so I'll share what some other care managers and other office hours have shared. It could even mean going with a participant to a doctor's appointment and going with them and explaining perhaps to the physician what that person is feeling or experiencing if they're not able to articulate it for themselves. It could mean advocating on the behalf of the individual as well. Just because someone is a doctor or a physician does not necessarily mean that they have experience in behavioral health. So advocating or educating the doctor on what, again, the person is experiencing or the medications that they are currently taking is a way of integrating care and bridging that gap with another healthcare provider as well.
Yeah, Stevie Barron's echoed that and said that it's important to try to get face-to-face contact with other providers, which is great.
Yes, definitely. And using your role as a care manager in a way to let the primary care physician know that you're only there to help. You're there to help that individual understand or increase their health literacy, to understand what their options are, help understand or how to manage their illness, and that doctor should be talking to you, should be working with you in order to help that person have the best healthcare outcome. So that's another way of bridging the gap as well. Okay. So let's go on to culture. How do you promote cross-cultural communication and learning? So what are some questions you ask someone to help you to get them, help you to learn a little bit more about them and what is important to them? Maybe perhaps some questions that are not necessarily on an assessment form or intake, or even an opening. You're meeting someone for the first time. What's an opening question to them to start that engagement process? Okay, so someone mentioned another office hours, or maybe it was even me, that especially around the holidays are fast approaching. So for instance, if you don't know what your, or how, or if your clients have any cultural celebrations, do they celebrate Christmas? Do they celebrate Hanukkah? Or is there some other cultural aspect that is important to them? Do they not celebrate at all? Those are things to learn about someone and get to know. How does the holidays impact upon a person? For a lot of people, it is not a happy time of the year. So is there anything culturally that they would like to practice or not practice, that they have not practiced in a while? What did they do? Or even asking them, how did they celebrate the holidays while growing up? And how did it impact upon their life? How do they feel about perhaps not having that same type of celebrations any longer, or would they like to start doing that again? Those are all part of one's culture and how it impacts upon them. For most people, this time of year is about celebrating with family, with lots of food. And so even asking someone what are some of their favorite types of food to eat can tell you a lot about their culture as well. Okay, so we only have a few minutes left, so let me go into other questions if there's no comments about this. Talk about outcomes. What are types of outcomes required by your agency? So what types of information that you have to track within, say, your EHR? And has it changed the way you engage with people or and offer services in any way? Okay.
Yeah, so no one's responded yet, but I've worked, I used to work under a Department for the Aging contract in New York City, and we did have to really track by quarter of an hour our engagement with people, and the different ways, like if we were just doing information and referral without, without something that had to do with the senior center, we had to track that a different way. And I did notice at some point, I actually was out on the street, not at the senior center, on a lunch break, and I gave just a random person on the street directions to a diner. They asked me, like, where's the nearest diner? And I thought, oh, I can track that as a quarter hour for information and referral. And so it kind of got in there in a very strange way, and it made me I had to really evaluate that and what that meant and how I was interacting with folks.
Yes. Yes. So yes, a lot of time what we do often translates to the rest of our life, our world, right? So an outcome measure that I'm sure most people have to track could be even hospitalizations. I know one care manager shared that not just the number of hospitalizations, but whether or not certain hospitalizations were preventable or not. So that's important to know. Tracking, for instance, someone who has frequent hospitalizations 1 year, and then tracking for the next year to see if those hospitalizations have decreased. Not just the number of hospitalizations, but also looking at what were the interventions provided that perhaps contributed to the decrease in hospitalizations. Also tracking how people use it. So did someone start to use their primary care physician or urgent care instead of going to the ER the way they used to? Teaching someone what is an emergency and what isn't, and tracking whether or not those interventions, again, have been implemented within that individual so that they are now making better decisions about where they should go for assistance when needed, and being able to distinguish between emergencies and non-emergencies. So those would be all examples, or could be an example of some of the outcomes that you guys are tracking as well. Okay. And so for our last question, let's skip to health literacy. What are some ways you can help someone increase their health literacy? So if someone doesn't understand their illness or what their options are in regards to treatment, that could be physical health care or behavioral health care, what are some ways some things that we can teach that person, or things that we can do with them to increase their health literacy? And I remind everyone that during that webinar, there are different ways to measure one's health literacy, and the links are within the PowerPoint. So if this is a new topic for you, or you want to know more information, or don't even know where to start to, or some of your clients who really need this, there are a lot of different tools out there that can help you to help them increase their health literacy. So it can also include translating information for someone. So a lot of times information is in medical terms, not in layman's terms. So if you're able to translate that information for them, that's one way of increasing their health literacy. We can actually ask clients to do active listening with us, meaning asking them to tell you what they've learned, to summarize the information, like you're teaching them something or information, asking them to reflect back to you what they've heard. We can also practice repetition with them as well. It could, for instance, it could be filling out their pill box correctly and asking them to repeat that action and doing it over and over again until they do it correctly. And another way could even be advocating on the behalf of the person. So again, part of that would be using with their medical provider, asking the medical provider to please use simple language and not medical jargon when they're talking to their patient about their medical condition. Those are all different ways of helping someone increase their health literacy, and even our own health literacy as well. Okay. So actually, I'm looking at the time, and we have concluded our office hours for today, and I want to thank all of you for listening and participating, and to remind you that if you have not had a chance to view any or some of the webinars and videos, they are posted for your review. There is actually another version of office hours, or another recording of office hours, that is posted as well. If you want to go back to review some of these slides, they are also available on the Care Management Training website also. So with that, I want to thank you all again for participating, and I wish you all a great rest of week, and to please engage in some self-care today and always. Okay. Thank you.